News.
Idahoans, first of all, are fiercely independent. They value their health, but they also are not willing to spend money on things they don't quite understand, or they like their freedoms and their choice.
There is concern among Idahoans of the future of health care.
CBS 2's Kristen McPeak found out what's working and what could soon be available for patients.
When it comes to healthcare, Idaho is unique. One of our strengths is that we have a menu of options when it comes to healthcare, but there's still some work that needs to be done.
I'm an Idahoan too, so I like the idea of give me the information. Let me govern myself. Let me choose my own path.
Dean Cameron is the director of the Idaho Department of Insurance. The department ensures insurance providers keep their promises. Cameron says they also focus on making healthcare affordable.
It's still not where we want it to be. Prior to the ACA, the Affordable Care Act, Idaho boasted the lowest rates in the nation. And then after the ACA, our rates significantly increased because of the mandates and other issues that were imposed with the ACA.
He says moving forward, states, they need to get creative.
Let the states innovate and decide what's best for them, rather than, what works in New York won't work with what we need here.
Cameron says when it comes to serving Idahoans, price transparency in medical care is important. Now there's also telehealth. This is something doctors say will help keep costs low. It's something that was brought up in this 90-page report. It was written by a bipartisan task force aimed at helping improve healthcare across the United States. Idaho Representative Rick Youngblood is just one of many lawmakers from across the country who contributed to these findings. He serves as a co-chair on the Joint Finance Appropriations Committee. The report, it highlights needed improvements. These suggestions include improving broadband for telehealth services, encouraging electronic health records, and policy to address rural healthcare challenges. In serving on the Joint Finance Appropriations Committee, Representative Youngblood says that a combination of these policies will help with costs.
The largest for me personally is seeing that those things are in place and functioning well so that it drives the cost of the state's funds down.
To keep costs down, many health professionals are turning to a new framework.
What does Idaho need to do better to improve paying for healthcare or healthcare costs and healthcare in general?
Again, value-based care. That's the answer in my opinion.
Value-based healthcare, a new approach more people are talking about. It means providers are paid based on the quality of care they provide rather than the number of patients they see. Jenny Gudapati is the director for the new value-based healthcare program at Boise State University. Growing up and raising her family in Idaho, she's worked in hospitals as a nurse and sees value-based healthcare as a growing need.
There's those people that the only health care they had was when they would come and see us in the emergency room. And so what typically could be done in a doctor's office, we would take care of in the emergency room.
Gudapati says value-based healthcare will help solve these problems.
It will allow their physicians to get reimbursed for creating wellness programs, better looking at preventative screening, looking at preventative medicine, where in the past there was no reimbursement for that. The only way physicians got paid is when people were sick. You'd go to their office, you'd go to the emergency room, and it was basically line item charges that they would then get reimbursed for.
Gudapati says this new program at Boise State will help Idahoans in the long run.
It's probably the most exciting time. I think it's more exciting to be in healthcare now than when I started my nursing program so many years ago.
Idaho Governor Brad Little hopes that 50% of healthcare payment contracts will be value-based by 2023. In Boise, Kristen McPeak, CBS 2 News.